Sciatica is a very complicated condition, and there's so many different causes to it. In this video, I'm going to cover 10 treatment mistakes that people often make when trying to help their sciatica problem. But let me just preface it with this thought so that you can understand why you might be getting certain treatments from different individuals, different healthcare professionals, or you might be looking them up online to wrap your head around why some of these things are helpful but harmful at other times. Well, there's different intensities of sciatica that you might go through, and there's also different causes of sciatica. It might be coming from the low back, could be coming from the pelvis, or even the way that you're moving, or muscles can also affect this too. And because there's so many different causes, there's different treatments for each of those causes, and they may be even happening at the same time. You might have a low back problem and a pelvis shift and a muscle problem all happening simultaneously. So it matters what treatment you're doing and when you're doing it in the course of sciatica, because a certain treatment might be great when sciatica is very intense, but it might be useless when it's relatively mild. And another treatment might be great for sciatica that's coming from a herniated disc problem, but might actually make things worse if it's coming from a shifted pelvis problem. Now, I'm going to explain why all 10 of these problems might hurt your sciatica problem. But before you go through all 10 of these problems and possibly get more discouraged about your sciatica issue, I want you to know that I've got a full playlist, tons of videos on how to help sciatica. It's linked in the description below. Once you're done with this video, go check that out so that you can begin to find the right things to do to help your sciatica problem, and at the right times, of course. So let's get into the top 10. Number 1 is resting for too long. Now, you might even be following doctor's orders with this. Your doctor may have told you, go do bed rest, go sit on the couch, go sit on the recliner, go lie in bed until the problem goes away. Or very often, what I hear patients tell me is, my doctor just said to go rest. They didn't say how long, they just said until it's better. But after a week, or even just a few days, or even several weeks of being in bed rest, what the patients are saying is they're getting up and feeling worse when they move around. Oftentimes, even the pain gets worse when just resting. Now, this is good advice for very intense sciatica because the nerves are irritated, and getting the irritation to calm down means you have to move less temporarily. But once the irritation has gone down a certain amount, then it's time to incorporate some movement, and bed rest is no longer a good idea. And there's no set time frame. It's not like it's going to be, one day for everybody or 1 week for everybody. You have to have a good handle on when you're able to begin to move without making the problem worse. And you might only tolerate a minute of movement or maybe 10 minutes of movement before it starts to get worse. You have to move within the amount of time that you can tolerate movement without making the problem any worse. And number 2 is exercising back muscles. This exercise is often given to patients in a variety of different ways. Sometimes you're lying face down and you're picking up your upper body, and the goal is to exercise these back muscles that are right here. Other times you're just standing up, putting your hands on your waist and leaning backwards like this. Whenever you exercise those back muscles, it usually adds more compression to the spine. And if your sciatica problem is coming from a herniated disc in the lower part of the spine, then you're going to add more compression to that disc and possibly directly to the nerve. And over time, because it may not be an instant pain, like you do the motion, you do the exercise, and you right away feel pain, it may be that it comes on worse as the days go by of doing this exercise. Definitely as the weeks and months go by of doing back exercises, it tends to get worse. In every case of sciatica that I've ever seen in my career, and that I've trained with patients on, and that I trained as a mentee with my mentors, weak abdominals is part of the root problem. And exercising the back muscles that are on the other side of the spine tends to feed the problem, because when you exercise the abdominal muscles, it corrects the imbalance. Now, exercising abdominal muscles is probably not the best idea early on when it's severe, but as the symptoms calm down, then you need to begin to get those ab muscles active again. Problem number 3 is exercising through pain. Now, even though there's good exercises to do for sciatica at certain times, for certain types of sciatica, if you're hurting, it's not a good idea, even if it's a good thing. Your nerves, your sciatic nerve especially, is telling you it doesn't like what you're doing, so don't force it, because you're gonna further irritate the problem. And sometimes there's healthcare professionals out there, fitness professionals, friends, family, that might tell you, oh, it's okay, this is gonna help it, just go through it, because it helped them. And if it helped them, they're assuming that it's going to help everybody. But if your sciatica problem is from a different source than their sciatica problem, then it might not help you. It might actually make the problem worse. You should be able to recover from your sciatica problem by doing exercise that feels good to do. Maybe you get tired, but it doesn't make your sciatica worse. That's how it should be. Number 4 is hamstring stretches for sciatica. Anything where you're putting your foot up like this, or you might be sitting on the floor and your leg's up and you're reaching towards your foot and it puts a stretch through this area of the leg. This tends to be a bad idea for sciatica because the sciatic nerve is right between those hamstring muscles, just like I've got on the skeleton right here. And whenever you add a stretch to this area of the body, you're stretching the entire sciatic nerve pathway in addition to the muscles, and you could be irritating an already irritated sciatic nerve. Now, the hamstring muscles will usually shorten as well because they're innervated by the sciatic nerve, and their response is to stiffen up and tighten up. So you might actually feel relief in the moment when you're doing stretching, but if you're repeatedly doing hamstring stretches in an effort to fix a sciatica problem, you're going to tend to keep that nerve irritated, and it's not going to go away for the long term. Stretching is also not correcting the root problem, but it might bring you some short-term relief as long as you're not aggravating the sciatic nerve, which is really difficult to do on a hamstring stretch. You're probably going to get the nerve too. Number 5 is a figure 4 stretch. So what this is when you take your leg and you bend the knee and you move your leg in this position right here, and it puts a big stretch through the glute, the back of the hip, the butt area. And because the sciatic nerve is depicted here with this green strap is right there, and there's muscles in the area too, you can stretch everything in the area. And it may feel good because the muscles get tight there, like with the hamstrings, but long term you're adding a lot of stretch to that nerve and it's going to stay irritated, just like with the hamstring stretch idea. Number 6 is massage for sciatica. Because the sciatic nerve tends to be buried in muscle on the back of the hip and the back of the thigh, it's often tempting to start to massage the area. And if you find a stiff muscle, massaging it actually kind of helps. The problem is when you find the nerve, and people typically know it. When you push on a certain spot and it starts to radiate out a bit, it even hurts so good, that kind of sensation, it typically is a nerve. And if you rub on that area, you're just rubbing an irritated nerve. It's the equivalent of if you had a cut on your skin and you just rub it, it's hurting it and it's irritating it more, and you're going to make that injury worse. It's going to take longer to heal. Now, there's not an actual cut on the nerve and it's not bleeding necessarily, but there's irritation to the sciatic nerve, and if you rub it out, it's going to make it worse. Now, some people do this with a tennis ball. They'll sit on a ball, a foam roller, they'll get a professional massage, or they'll get one of those massage guns and stick it right where the nerve is and do vibration massage, percussion massage. All of these forms of massage are typically going to irritate the nerve more. Now, you have to be careful with this, and in full transparency, when I see a patient here in the clinic for sciatica problems, I do massage on them, but I can tell the difference between a nerve and a muscle when I'm feeling somebody, and I make sure to stay only on the muscles. And my touch tends to be significantly lighter, but way more effective because I'm very strategic with where I go in. If you don't have that kind of sense, many people do actually, they can kind of tell when they're on a muscle versus a nerve, but if you aren't certain, you're not sure, and then you've tried massage and it's made things worse, I'd back off of it and not do it. Now, this is especially the case with a very irritated sciatic nerve. You don't want to be rubbing it out because everything's going to hurt it at that point. Rest tends to be the best thing for an extreme irritation, but then you got to get moving, you got to start doing other things. Massage could be an option, but use extreme caution that you're not on the nerve. Number 7 is relying on braces. Sometimes people will wear a brace, especially around their low back, their waist area, to get stability for their vertebrae in their back. This is helpful if you've got a disc herniation that's contributing to the sciatic nerve problem. There's also braces that go around your legs to try to get the nerve, the sciatic nerve, going down the leg. These braces might all be helpful, but only in the short term. They're not addressing the root problem of sciatica, the muscle imbalances, the shifted pelvis. There's other things that are causing sciatica, and these braces aren't going to fix it. They're going to buy you some short-term relief, and it's natural. It's not taking pain medications, which of course can cause other issues, side effects. But relying on braces to solve the problem, like putting it on and saying, oh, this is going to fix my sciatica problem, you can't do that. You have to tell yourself, I'm putting this brace on to buy myself some time to reduce the irritation so that I can work on the right exercises that are going to take the problem away for the long term. That's often the case that people will wear braces, feel pretty good relief if they have relief, because they're not always effective with everyone. And after a few days, at most a few weeks, the relief that they got from the brace starts to wear off and the symptoms come on just as intense as they were before the brace, and now the brace feels ineffective. Now, doctors will often recommend braces to patients and they'll be happy when they feel relief, and then doctors will present in the step-by-step process. They'll say, well, try the brace out, the brace didn't work, then let's try the next thing and the next thing, and eventually it goes down to surgery. So let's go down that pathway next. Now that takes me to number 8. A doctor's typically going to recommend a medication. If you haven't tried over-the-counter medications for your sciatica problem, the doctor might recommend prescription strength medications. Now all these medications, whether they're prescription or over-the-counter, they're just masking the pain symptoms. Some are more focused on nerves, some are more focused on other stuff like the ligaments, the tendons, the bones, other tissues, non-nerve tissues basically. The purpose of these medications is to buy you some time to reduce the symptoms so that you might sleep better, so that you might tolerate walking and doing normal things that you have to do, being able to not be so grumpy when you're in pain. Pain medications have their place in treating sciatica, but they're not curing sciatica for the long term. They're not addressing the root problem. They're merely buying you some short-term relief, and you have to understand that there's side effects to taking all these medications. They can affect your liver, your kidneys, and other organs in your body if you're relying on them for the long term. It's just not appropriate for you to take a medication and assume that it's going to fix the sciatica problem. There's some sort of mechanical issue in your body that's setting up the sciatica issue, and that mechanical problem needs to be addressed, and a medicine does not address it. It's usually a strength imbalance that will address the mechanical issue. And if the painkillers don't work, it brings me to number 9. A doctor is going to recommend injections. Relying on injected pain medication is very similar to taking medications by mouth, except this time there are certain medications that are injected directly into the area they suspect is the root of the problem. Sometimes they'll use it as diagnostic, like they'll say, well, let me inject your spine at this specific place to see if that's the main cause of the sciatica, or let's inject a little bit lower in the SI joint. That's another common place that gets injected for sciatica, because the SI joint can get affected when the pelvis gets shifted. And they'll test to see if you get relief or not. But even if you do get relief, you have to understand that this isn't going to fix the problem. It's just pain medication in that area. It's causing a decrease in inflammation, and it's helping the pain temporarily. You need to use that time to go fix the muscle imbalance so that you can then have long-lasting improvement from your sciatica problem. Plus, one of the dangers of using steroid medications that are injected is that it breaks down connective tissue over time. Connective tissues are things like tendons and ligaments, and even the discs in your spine are made out of connective tissue, and these can all be damaged over time if you get repeated cortisone or steroid shots for pain relief. And number 10 is the last step that a doctor might take you through. It's getting surgery too soon, because surgery has its place as well, and it might be beneficial for you, especially if you know that the MRI shows a massively herniated disc that's directly compressing a nerve, and it's consistent with the symptoms that you have. Like it's on the same side that you have your sciatica problem, like the left, for instance, and it's at the nerve root level that is consistent with the way that your weakness and your pain shows up. And that's another thing, weakness, because if you have intense pain but not necessarily a ton of weakness, you might not actually need a surgery because the nerve's working, at least to the muscles. You have strength in the muscles and use of those muscles. It's only when there's debilitating pain and debilitating weakness that a surgery is going to be highly recommended to solve a sciatica problem. Now, I've seen tons of patients that have had mild disc herniations that are pushing on a nerve, even moderate disc herniations pushing on a nerve, and they have done just fine with natural treatments like what we do here in our office, guiding on proper exercise, fixing the root muscle imbalance, so that they can get the pressure off the nerve, off the disc, and give the disc a chance to heal and the nerve to operate normally. They'll do just fine without having surgery. We've even seen patients with severely herniated discs that are obviously pressing on the nerve, and we've told them, you might need surgery, let's give this a go, see how you do, and they've actually gotten better just fine, because it turns out the main root of the problem wasn't coming from the spine. Even though the MRI showed a severe disc herniation with apparent pressure on the nerve, the main issue was actually the pelvis that shifted, which we treat here naturally just fine. and that relieved the sciatic nerve pressure. Now, we still educate and coach and treat on taking pressure off the disc in the spine so that that doesn't become the main reason and lead to an unnecessary surgery potentially, because it could have prevented it by treating the muscle imbalances to relieve the pressure on the disc and heal the disc and allow the nerve to operate well. But sadly, I've seen tons of patients that ended up getting disc surgery, whether it's a discectomy procedure, a microdiscectomy procedure, or a fusion surgery where they put rods and screws into the spine to hold the spacing in the spine well off the disc and off the nerves. And they have a relapse of their back issue. They have another disc that's herniated above or below, and that can cause sciatica symptoms as well. When it relapses, that's just dreadful for me, because I have to tell my patients that the root problem was never fixed, and then they come to the realization that they might have had a surgery when they didn't need to, because now they go down the pathway of fixing the root problem, and if they improve, which they usually do, then they start to say, so I didn't need that surgery? And I have to tell them, hey, I didn't see you at the beginning when you had all this problem. I don't know what you look like at that point, but what I know now is the problem's better. It's maybe even gone, and at least you don't need a second surgery, and that's good news. So use caution when signing up for surgery. Make sure you go after treating the root problem. And again, there's a playlist down below in the description where I lay out all the root problems and how to fix them in our playlists on YouTube here. Go check out that link. It's called Sciatica Pain Help. If you thought this video was helpful, please give us a thumbs up. Please share this with a friend, somebody that you think needs to see this. And also subscribe to our channel if you haven't already, and turn on our notification bell so that you don't miss out on any of the helpful videos we post every week. Thank you so much for watching. I hope to see you in the next video. Bye-bye.